Hello everyone and welcome back to my Medical Insight series. Today I'm discussing the molecule PCSK9 and the medications designed to target it, namely PCSK9 inhibitors. In this brief talk, I'll introduce you to monoclonal antibodies, and in my next video I'll discuss inclisiran, a novel approach to inhibiting PCSK9 synthesis. Let's get started. Normally, the LDL particles in the bloodstream are taken up by the liver cells via LDL receptors, which are scattered on the liver surface. The internalization of these particles is called endocytosis. When a cell takes up substances from its environment through endocytosis, they first enter endosomes. Endosomes play a key role in the sorting and recycling of internalized substances. From there, the LDL particles are sent to lysosomes for degradation, and the LDL receptor is recycled back to the cell surface to internalize more LDL particles. Each LDL receptor can be recycled for about 150 times before degradation. This highlights an important point. The more LDL receptors there are on the liver surface, the more LDL particles we can clear from the bloodstream. It's essential to note that LDL particles transport most of the cholesterol in our blood. PCSK9 is synthesized in the liver cells, specifically within the rough endoplasmic reticulum, which is crucial in producing many proteins. Once synthesized, PCSK9 undergoes processing and maturation in the Golgi apparatus before being released into the bloodstream. PCSK9 is vital for cholesterol balance as it can both increase or decrease the presence of LDL receptors on the liver surface. The significance of PCSK9 became evident in 2005 when researchers identified families with severe early-onset heart disease with extraordinarily high cholesterol levels. These families had gain-of-function mutations in the PCSK9 gene that intensify the effects of PCSK9. Conversely, some families exhibited exceptionally low cholesterol levels due to loss-of-function mutations in their PCSK9 genes. These pivotal discoveries highlighted PCSK9 as a promising therapeutic target. With PCSK9 present, the endocytosis process is different. PCSK9 binds to the LDL receptor along with LDL particles. Once internalized, this complex is sent to the endosome. However, because of PCSK9's presence, the endosome struggles to separate the LDL particle from its receptor. As a result, the entire complex is directed to the lysosome for degradation, and LDL receptors are not recycled. This results in fewer LDL receptors on the cell surface, leading to an increase in cholesterol levels. This process demonstrates that disabling PCSK9 by antibodies or impeding its production will reduce LDL cholesterol. PCSK9 inhibitors are antibodies designed to target and neutralize this protein in the bloodstream. By binding to PCSK9, these inhibitors prevent it from attaching to the LDL receptor. This allows the LDL receptor to process LDL particles normally and then recycle back to the cell surface. Clinical trials have shown that PCSK9 inhibitors can significantly lower LDL cholesterol levels by up to 55 to 60%, even in people who were already taking other lipid-lowering therapies such as statins. This is a simple flowchart to decide who should be started on PCSK9 inhibitors. 1. Does the patient has familial hypercholesterolemia or ASCVD? ASCVD or atherosclerotic cardiovascular disease include patients with a previous heart attack or coronary stenting, bypass surgery, or severe coronary disease on cardiac imaging. If no, the patient isn't eligible, and if yes, move to the next question. 2. Is the patient on maximum statin therapy? If no, recommend maximizing statin therapy first, and if yes, or if they've had adverse reactions to statins, proceed to the next question. 3. Have other lipid-lowering medications such as isoterol or bempedoic acid been tried? If no, these should be considered before PCSK9 inhibitors, and if yes, move to the next step. 4. Is the patient at high risk for future ASCVD events based on current risk calculators? If yes, and the LDL cholesterol remains above 1.8 millimole per liter or 70 milligram per deciliter, despite all the above, PCSK9 inhibitors should be considered. Thank you for your attention, and I hope you found the video informative. The next video will be about PCSK9 synthesis inhibitor drug, inclisiran, and its unique mechanism of action. Please remember to subscribe to the channel to be notified when the next video is available.